My name is Brent Fisher. I'm a primary care sports physician with EmergeOrtho, and I work in our orthopedic urgent care setting.
What is PRP therapy and how does it work?
When somebody asks me about PRP, I, for one, explain the acronym is platelet-rich plasma, and then we talk about the different components of it and that kind of thing. With PRP, what you have is you're taking somebody's blood, spinning it down in a centrifuge, and trying to pull out a higher concentration of platelets within the plasma and eliminate some of the red blood cells and some of those other components, so that you have, instead of having just the 1 times amount of platelets that you would in their blood draw, you have at minimum like 2 plus that. And what we have in the platelets is you have like different growth factors that help recruit all these healing properties to the area. Just like you do when you get a cut on your arm, you have platelets show up, and then they start the clotting process, but they also start the regrowth and healing process. And we can use that for multiple different orthopedic conditions.
What types of conditions or injuries can PRP help treat?
PRP can help treat several different orthopedic conditions. The ones with the best evidence for them are knee arthritis, osteoarthritis in particular, and then also tennis elbow or lateral epicondylitis and gluteal tendinopathy, which is what a lot of people will call like trochanteric bursitis, but it's pain on that lateral part of the hip that will often diagnose and confirm that it's the tendon and not the bursa. But you can also use it for multiple other areas in orthopedics, including meniscus tears, plantar fascia injuries, and other muscle and tendon injuries or chronic conditions to try to help bring some pain relief.
How long does it take to see results from a PRP injection?
PRP doesn't work fast like you would hope with like a steroid injection and that kind of thing. With PRP, you do have to have some patience. So with the patients that get benefit for orthopedic for like arthritis issues, you're usually looking at around like 6 weeks to start to see the benefit. And then with like tendon injuries and healing, such as like tennis elbow, gluteal tendinitis, you're looking at 12 weeks before you can say it did or didn't work.
Are there any restrictions after receiving PRP, such as activity limitations or dietary changes?
After PRP, we do like patients to restrict certain medications, but we also want to coordinate that with their primary care provider or their specialist, whoever's prescribing those medications, and discuss the risk and benefits. So sometimes they'll need to be off NSAIDs, such as like ibuprofen and those kind of medications, or we'll talk about the risk and benefits of being off aspirin for a period of time, and need to have those conversations just because they do affect how platelets work. With regard to activity limitations, we don't have a lot for treatments for osteoarthritis because the injection is very similar to what you'll get with a steroid injection, so there's not a lot of difference there, and you can allow them to get back to their activity pretty quickly. With regard to tendon injections, it's a little bit more invasive, and there has to be a little bit more treatment to the tendon, and so therefore we'll usually restrict them for a period of time and even talk to them about doing some physical therapy or some other home therapies afterwards.
How does PRP compare to other treatment options like cortisone injections or surgery?
PRP has some evidence that in some conditions that it can actually work better than steroid injections in the long run. It doesn't, in my opinion, I haven't seen enough evidence to say that for osteoarthritis and some of those conditions that it provides lasting or like permanent healing of the cartilage and that kind of thing, but it can provide some lasting relief for those individuals that want to avoid surgery. If somebody's looking for a permanent fix with regard to like hip arthritis or knee arthritis, and they're not interested in injections for multiple treatments, then surgery might be the better option for them. With regard to tendon injuries, specifically like tennis elbow, gluteal tendinitis, tendinopathy, those conditions you can actually provide pretty significant lasting healing and treatment, and they tend to work better than a steroid injection that's going to help for a short period of time, and then the pain might come back.
What should patients consider when deciding if PRP is the right option for them?
When patients are thinking about whether or not to receive PRP treatments, They need to consider what their long-term goals are and their short-term goals. If you're looking for quick relief, it's probably not the right thing for you. If you're trying to get to where you feel better, next week, the week after. If you're looking for a little bit more lasting relief for a condition you've been dealing with for a while, I think it's definitely a good fit. If you're looking to avoid surgery, then it's definitely something that we can talk about and decide, is this the right thing for you to do, or do you need to consider something else?